As you know, allogeneic transplant is more or less done in the setting of clinical trials, and is not considered standard of care in patients. And with the available of new therapies, the number of patients going to allogeneic transplant myeloma has gone down. But one of the questions that always comes up is those patients who had an allogeneic transplant before for myeloma, and once they progress, what is the safety and feasibility of using novel immunotherapies like CAR-T and bispecific antibodies? Because ultimately they are going to use the T cells, whether engineered or non-engineered T cell, to fight against the myeloma. So the question of the safety and feasibility needs to be explored. Now, if you look at the pivotal studies, for the CAR-T, the CARMA excluded the patients with the prior allogeneic transplant, but the CARTITUDE-1 did include patients with prior allogeneic transplant. There were a small number of patients, and like about 8.2% of the patients. So we wanted to look at that in a more, larger scale from our patients that we treated for both CAR-T and bispecific antibodies, because both uses the T cells. And you can see what we saw that the patients who had prior allogeneic transplant and undergo treatment after relapse with both CAR-T and bispecific antibodies, we did not observe any kind of adverse events related to the use of prior allogeneic transplant. Like there is no exacerbation of GVHD. The grade 3-4 adverse events were pretty comparable with the other patient population, and it seemed to be the comparable safety profile with other patients who didn't have allogeneic transplant. In terms of efficacy, we saw very deep and durable responses, and these patients have a very deep and ongoing responses with both CAR-T and bispecific antibody. So that tells what our study suggests is that that using CAR-T and bispecific antibodies in patients prior to allogeneic transplant is possible, and these patients could derive durable responses and deep responses without exacerbation of the other side effects that could be due to the prior allogeneic transplant.